All right, well, we will go ahead and get started. Hi, everyone that is tuning in now and everybody that will be watching the recording later. As I mentioned, my name is Kat Rudolph, and I am the state policy representative for the Iowa Academy of Nutrition and Dietetics. If you're unfamiliar, the Iowa Academy is an affiliate of the Academy of Nutrition and Dietetics, a not-for-profit professional organization that for registered dietitians, dietetic technicians, and dietetic students. Thank you so much for tuning into today's webinar, Advancing Nutrition Security Policy in Iowa, Making the Case for SNAP. For now, we ask that everyone please mute your microphones. If you feel comfortable, please introduce yourself in the chat, to say your name, maybe what you do, where you're from. And then we highly encourage you to use the chat to ask questions or make comments throughout the webinar, but we'll save answering the questions until afterwards. So at this time, I'm excited to introduce our speaker today, Luke Alasinga. Luke is the Policy and Advocacy Manager at the Des Moines Area Religious Council DMARC Food Pantry Network in Des Moines, Iowa, and the chair of the Iowa Hunger Coalition, a statewide advocacy group focused on ending hunger and food insecurity. He is a graduate of Iowa State University, AmeriCorps Vista alum, 2017 fellow of the New Leaders Council Des Moines chapter, and a current Health Connect fellow with the Mid-Iowa Health Foundation. Additionally, Luke is currently pursuing his Master of Public Policy from the University of Northern Iowa. He lives on the south side of Des Moines with his wife, daughter, 2 cats, and dog. Welcome, Luke. Thank you so much for being here.
Thank you, Kat, and thank you everyone for joining this webinar on this beautiful Friday afternoon, I guess technically. I'm going to share my screen here real quick and get this slideshow ready to go. As Kat mentioned, if you've got questions, please share them in the chat throughout. Typically, I like taking questions as they arise, but there's just a lot I'm going to cover today in the presentation. And to keep me on track, I'm just going to ask that you ask those questions in the chat and we'll save those for the end. So there is a lot I'm going to cover in here. I might not hit on all the points in the slides, but we'll be sending these slides out afterward, I know. And I'm always happy if you've got follow-up questions to reach out with an email, and I'll put my email in the chat as well. But thank you again for joining. We're going to talk about some basics of the Supplemental Nutrition Assistance Program, or SNAP, and we're also going to talk about some recent kind of policy developments with SNAP. So very quickly, just a little bit of info about the Iowa Hunger Coalition. We're a membership-based 501c4 organization. We have a volunteer board of directors, no paid staff members, and we use our collective voice to educate and advocate for policies that would eliminate food insecurity and build equitable food systems in our state. All right, so jumping into SNAP. SNAP is the nation's largest hunger relief program. So nationwide, federal nutrition programs provide 19 out of every 20 emergency meals. That's a figure shared by Bread for the World. So if you're not familiar with SNAP benefits, they used to be called food stamps. These days, benefits are loaded onto an EBT card, and they can be used just like a debit card to purchase approved food items with SNAP benefits. I just got the latest SNAP data for April yesterday, and right now there are 268,000 Iowans who participate in SNAP, and that's actually the lowest number since July 2008. So we're at about a 15-year low for SNAP enrollment in the state right now. So how's SNAP administered? It's administered by USDA Food and Nutrition Service at the federal level. At the state level, it's administered through the Department of Health and Human Services. SNAP benefits are 100% federally funded, but then states have a 50-50 cost share with USDA on the administrative costs. So a little bit around program eligibility. So the federal income eligibility for SNAP is 130% of the federal poverty level. But states do have some flexibility to increase the gross income eligibility amount to up to 200% FPL through a mechanism called broad-based categorical eligibility. So currently the gross income eligibility for SNAP in Iowa is 160% FPL. That's equal to an annual gross income of $21,744 for a single adult, or a little over $44,000 for a family of four. There is currently no asset limit for SNAP in Iowa. That is changing, and I will touch a little bit more on that near the end of some recent policy changes we've seen in Iowa. Talking a little bit about work status and program eligibility. So for SNAP, there's a general work requirement for everyone ages 16 through 59, which basically just means and students are exempt from this, but you have to be working at least 30 hours a week or be registered with employment and training programs. There's a number of exemptions. That's a little bit more loose. There's a stricter work requirement called the ABOD time limit. And ABOD stands for able-bodied adults without dependents. So these are people age 18 through 49, don't have dependents. They're physically and mentally able to work. If they are not working, they can only receive 3 months of SNAP benefits every 3 years if they're not working at least 20 hours per week. I will also touch back on this in a little bit around recent policy developments with the debt ceiling and farm bill negotiations and the ABOD time limit. So how the application for SNAP works is people can apply online, paper application, or over the phone. It can take up to 30 days to process an application from the time it's submitted. So folks fill out that initial application. There's a follow-up interview with a worker from HHS. They're going to be asked to verify and produce documents verifying their income, their identity, expenses, things like that. And then they will be granted a decision that will say, yes, you've been approved for benefits. Here's your benefit amount. You'll get your EBT card on this date. Or, I'm sorry, you do not qualify. Here's why. And applicants can go through an appeal process to kind of appeal that decision. So after this initial application, there's also what's called recertification. So this people go through periodically, and it's just a process to continue receiving benefits. Most households, that's every 6 to 12 months. For certain households with elderly or disabled members, they might only need to recertify every 12 months. But for a lot of people, it's still once a year. And then for that ABOD group, those are typically a lot more frequent because of that time limit and needing to verify that people are working. So for the ABODs, that can be every 3 months. A little bit about program integrity. SNAP has a whole quality control program where the federal government will look at states and do more like in-depth quality control interviews and things like that. Just to make sure that there's strong program integrity. Trading SNAP benefits for cash or other items is known as trafficking fraud, and that happens at a rate of less than 1%. This past year in Iowa, according to LSA, the SNAP fraud rate in Iowa was 0.07%. So the fraud rate is very low for SNAP. We do have a hotline to report SNAP fraud. And for folks who have been found to be committing SNAP fraud, they can lose their benefits for, depending on the scale of the offense and whether it's their first time or a repeat, they could lose it for a year, more than that, or permanently be barred from the program. So how are SNAP benefits calculated? They are actually based on the USDA's Thrifty Food Plan. So the USDA has 4 food plans. There's thrifty, low cost, moderate, and liberal, I think. Thrifty food plan is the lowest cost plan that the USDA has. It's calculated based on cost of food, nutrients, nutrition guidelines, what Americans eat. time to prepare food, things like that. There's a whole formula that goes into it. There's a cost of living adjustment for the Thrifty Food Plan, and by extension, SNAP, that's calculated every June, and then those go into effect in October. So a couple years ago, there was a modernization of this Thrifty Food Plan that led to a permanent increase of SNAP of around 25%. So when someone's applying, there's all these things that get plugged in based on their income, different household expenses, there's different deductions people can claim. And that all gets plugged into a formula. And then we'll kind of spit out the benefit amount that people can expect. So what those benefit amounts look like, the minimum SNAP benefit is $23 a month. The maximum SNAP benefit, and this is for one individual, is $281 a month. And on average, people are getting about $161 per month as SNAP benefits. So it's a range there between the minimum and the maximum. So it just depends on different household characteristics, expenses, things like that. Also wanted to talk about the economic multiplier effect of SNAP. So this is something that's determined by the USDA's Economic Research Service. They update it periodically, every so often, every few years. But it really looks at the economic benefit of SNAP, not just in the grocery sector, but across our economy. And according to USDA ERS, every $1 in SNAP benefits generates $1.54 in economic activity. And that's because SNAP frees up money for households to spend on not only food, but also other essential household goods that they would not have been able to purchase without these SNAP benefits. And really just want to underscore that SNAP not only supports low-income Iowans, but it also helps support our farmers, growers, manufacturers, producers, and retailers, and especially in rural parts of the state that don't have as many grocery stores and access to grocery stores. SNAP can really help those smaller grocery stores in rural areas of the state. I also want to talk about Double Up Food Bucks. I don't know if folks are familiar with this, but this is a program. It's not national. Although a lot of states do have some version of this program, but it's a nutrition incentive program for SNAP participants operated by the Iowa Healthiest State Initiative. And essentially how it works, it is not statewide, so it's only at participating farmers markets and retail grocery stores. But if folks are on SNAP and are using their benefits at a participating retailer, and they use their benefits to purchase fresh fruits and vegetables, they can receive a match of those benefits that can only be used to purchase fresh fruits and vegetables. So how this looks practically is if I was at a farmer's market, they might have a little stand where people can, redeem their EBT benefits for tokens or things like that to spend at the farmer's market. If I go and I'm going to be spending $10 of my SNAP benefits on fresh fruits and vegetables, I can get an extra $10 in Double Up Food Bucks benefits that can only be spent on fresh fruits and vegetables. So this is a way to provide a positive incentive-based approach to try to encourage healthier choices and help also bring down the cost of fresh fruits and vegetables, because we know fresh produce can be kind of cost prohibitive for folks. So, and especially locally grown fresh produce. So it helps bring down the cost of those fresh fruits and vegetables, helps encourage healthier choices, but also has even a greater effect on local growers. The economic multiplier effect for Double Up Food Bucks is actually $1.90. So there's even a greater, return on investment because of its connection to local foods as well. There's obviously the connection with the farmers market, but for those participating retailers, there's an agreement that they need to be purchasing a certain amount of their produce from local sources as well. So it does help support our local growth. Already mentioned this, I guess, the economic multiplier effect for Double Up Food Bucks. I will just throw out there, there's currently no state investment in the Double Up Food Bucks program. That is entirely through private charitable funding and the USDA's Gus Schumacher Nutrition Incentive Program. So as I kind of already mentioned, SNAP benefits are distributed through EBT cards. So folks will get that EBT card in the mail. Benefits are loaded onto the EBT card on the 1st through the 10th of the month. It depends actually on the first letter of the participant's last name, kind of determines when those benefits will be loaded on throughout the month. Participants can view their benefit amounts and their distribution date online. And then those Double Up Food Bucks benefits are distributed at the point of sale. So those aren't something people get in advance. Those are just when they go to make that purchase at the participating retailer, they can then get that Double Up Food Bucks benefit. How benefits are redeemed. There's over 2,800 retailers in Iowa that are approved to accept SNAP benefits. That includes grocery stores, convenience stores, farmers markets. EBT cards can be used at point of sale systems. And like I mentioned, Double Up Food Bucks can be redeemed at select retailers. Another thing I'll mention that's not a point that's on this slide is those grocery stores and convenience stores need to meet certain criteria to be able to redeem SNAP benefits. So for instance, for convenience stores, they have to have a certain amount of fresh fruits and that sort of thing. So if you've ever been at a gas station and there's like a little basket of some very pathetic looking apples and oranges, that might just be because they need that basket there to be able to redeem SNAP benefits. Maybe they also wanted to provide some healthy options, but I think that's worth knowing. There had been some recent attempts to kind of change those nutrition standards under the Trump administration, specifically for convenience stores, and there was a lot of pushback there. So what you can purchase with SNAP, it can be used to purchase most food items. I think the big exception here is you can't purchase foods that are hot at the point of sale or are like kind of ready to eat items. SNAP can be used to purchase seeds and food producing plants. And then obviously SNAP cannot be used to purchase tobacco, alcohol. It cannot be used to purchase supplements, pet food, cleaning supplies, diapers, and personal hygiene products. So that was a lot of me talking at you and a lot of text on the screen and a lot of information. So I tried to mix it up a little bit here and try to play a game with everyone. I'm not sure how this is going to work, but we'll try it out. So I think you might be able to do a reaction of like a thumbs up or thumbs down. I don't know. We'll see. You might need to kind of play this in your own head as we go. But I guess this is just sort of a quiz. So can you buy it with SNAP? Can you buy alcohol and tobacco with SNAP? Answer in your head or with a thumbs up or thumbs down. No, you cannot. Hopefully that's not a surprise for anyone. There's still some myths out there. This one pops up occasionally. Can you purchase fresh produce from the farmer's market with SNAP? I'm realizing now this woman has cash in her hand, so maybe not the best example. Yes, you can. Assuming they're able to accept SNAP, I guess. I think there's been a lot of farmers markets throughout the state that have been adding, the capability to accept SNAP. So I guess I'll add a little asterisk there. All right. Can you buy diapers with SNAP benefits? Yes or no? Thumbs up or thumbs down? You cannot buy diapers with SNAP benefits. As Kat mentioned, I do policy for a food pantry network in Des Moines, and that is probably one of the most requested items that we get at our food pantry is diapers, because they're expensive, and people aren't able to purchase them with SNAP benefits. All right, Casey's Pizza. Can you purchase it with SNAP benefits? Yes or no? No, you cannot purchase Casey's Pizza with SNAP benefits. This is actually one I have heard at the legislature of people saying, people are buying Casey's Pizza with their SNAP benefits. No, you cannot. You cannot buy hot prepared food with SNAP benefits, and that includes Casey's Pizza. Now, what about a take and bake pizza from Aldi or from anywhere, from Papa Murphy's? That is okay. Take and bake pizzas are okay because they're not hot prepared foods. So again, you see some kind of maybe questions about why we have some of the requirements we do. How about candy? Is that something you can buy with SNAP benefits? Yes, you can. Well, there was an attempt in Iowa this year to ban candy from SNAP, but that did not pass. The federal government has never granted any states waivers to ban candy from SNAP. You can buy candy with SNAP benefits. What about a rotisserie chicken sitting in the warmer at Hy-Vee or Costco or wherever you're getting your groceries? You cannot buy a warm rotisserie chicken with SNAP benefits because it's in the warmer and is considered a hot prepared food. Now, you could buy a little container of pulled chicken from one of these or something like that, but you can't buy the hot chicken. So I thought that was the last one. We've got one, maybe a couple more. Tomato starter plants. Yes, you can purchase starter plants and seeds with SNAP benefits. I think that's something not a lot of people are aware. All right. Thank you for playing. Sorry if that was kind of lame. The reason I added that is I think there's a lot of misconceptions about what you can purchase with SNAP benefits and also some things that don't necessarily make a ton of sense. Why you can purchase candy but not a rotisserie chicken with SNAP benefits. I also want to bring up, I should have made a slide for this. There's some really great information from the USDA around what people purchase with their SNAP benefits. There was a study back in 2016 that looked at SNAP households and non-SNAP households and found there really was not any significant difference in the types of foods that people were purchasing with their SNAP benefits. Now, that study at the time got picked up by the New York Times, and there was a big headline about people spending all this money on soda with their SNAP benefits. But if you actually look at the study found that there was not a significant difference between what people purchased with SNAP benefits and those without. So I think the study itself kind of got misconstrued in the public. There's also another study done in 2019 that was a survey of SNAP participants and asking them specific questions about their barriers to eating healthier. And the number one reason people gave for or listed as a barrier that kept them from eating healthier was the high cost of healthy food. So as a SNAP advocate, when I'm talking about how we can improve nutritional choices for folks on SNAP, I talk about increasing benefit amounts and also positive incentive-based things like double up food bucks. So that was a lot kind of on the basics of SNAP policy. I kind of want to shift now and talk about some recent changes we've seen to SNAP policy during the pandemic and even more recently. So during the pandemic, SNAP participants in Iowa saw additional benefits. This was nationally known as emergency allotments. And in Iowa, we saw those from April 2020 through March 2022. Iowa actually ended those early. Nationally, these emergency allotments ended just this past March. So you may have seen something in the news about nationally SNAP benefits being decreased. That did happen, but it actually in Iowa, that happened even earlier. That happened last year. And I'm realizing that I need to update this slide because those are no longer being distributed in other states. That stopped in March 2023. When folks in Iowa saw those benefits drop in April of 2022, on average, households lost $200 in benefits when those emergency allotments went away. The food pantry network I work at, other food banks, other pantries immediately saw more people turning to them for assistance. We did see a few increases following or during the pandemic and also following it. So as I mentioned earlier, there was a 25% permanent increase to SNAP in October 2021. And that was due to the Thrifty Food Plan being modernized. This was something that was a policy that was passed in the last farm bill saying USDA should, reevaluate this Thrifty Food Plan. It hadn't been updated in over 40 years. So this was the first time in over 40 years that SNAP's purchasing power was actually permanently increased. And it was because of that modernization, and specifically the modernization really looked at how much time people actually have to cook meals from scratch and made some changes there to modernize how those benefits are calculated. That was really good to see. But it is also happening around the same time as we saw these big loss in benefits. There was a 12.5% increase in October 2022 due to that cost of living adjustment for food prices. I believe that was the highest that cost of living adjustment has ever been, definitely in the past 30 years or so. And that's just because of the high, the big increases we've seen for food prices across the board. It's not on here, but I will mention in January, a lot of people saw their disability income increased, and that ended up kicking some people off SNAP. Other people had their benefits reduced because they saw an increase in their disability benefits. They then saw a decrease in their SNAP benefits. Also want to mention that ABOD time limit is currently waived for all states, but that ends July 1st. Because there's that 3-month time limit, we'd probably be seeing the impacts of that in September. So kind of a current look at SNAP in Iowa. Right now, we've got a little over 268,000 individuals in the state participating in SNAP. And as I mentioned, that's about a 15-year low. That's the lowest since July 2008. The average monthly SNAP benefit for a household in Iowa is $310. How that breaks down into an average per meal cost per individuals is $1.79. 90% of SNAP participants are also participating in Medicaid. And only 38 to 53% of Iowans who are eligible for SNAP participate in the program. Now, that's the state's own numbers, so I use them. Actually, don't think those numbers are super accurate. I think that's probably higher based on some other USDA reports we have on SNAP participation, but that is the official number that the state puts out. What we do know is that the SNAP participation rate is lower in rural areas, and it's much lower for seniors. I think there's some reasons around that. There's certainly a lot of stigma around the program still, and I think that the stigma is greater for older Iowans, and it's greater in rural parts of the state. I think there's a lot of seniors who see this as an issue of pride. And I've certainly heard from some that, oh, well, I want to save those benefits for someone who could use them more than me. And really want to let people know, you are not taking away SNAP benefits from anyone else by participating. This is a benefit that you're entitled to, as a taxpayer. So I think there's a lot of work to be done around SNAP outreach, letting people know. I guess another thing I've heard for some people is like, I know I'm only going to get $23 a month and it's just really not worth the hassle. So why bother? This is from a USDA characteristics of a SNAP households report. The state report doesn't really go into demographics. So this is the report we have for demographics. Just really want to underscore 2/3 of everyone on SNAP in Iowa is a child, a senior, or someone with a disability. So when we talk about SNAP being there to support our most vulnerable, that's what we're talking about. Only about 8% of Iowans on SNAP are able-bodied adults without dependents. And again, those folks have some stricter work requirements, though they are waived right now till July. Also want to put a plug. We have a tool on our website at the Iowa Hunger Coalition called our SNAP Map. Feel free to visit that website. It has county level SNAP statistics. I just updated those yesterday with April's numbers. So if you want to look at your county and kind of dig into the data, that has data going back all the way to 2003. So there's a lot that you can dig into there. Also talking about recent policy developments. I kind of alluded to this earlier, but there were a number of bills targeting SNAP and other public assistance programs this year in the Iowa legislature. One that kind of made the headlines was House File 3. Among other things, it would have restricted SNAP participants to only be able to purchase foods from the WIC approved food list, which is very short. It got some national attention. The headlines were like, Iowa Republicans want to ban fresh meat from SNAP. Obviously that was not their intention. Someone made a mistake somewhere along the line. I don't think they actually intended to ban fresh meat from SNAP in Iowa. I think they were looking for a nutritional guideline that already existed that they could throw on there. Ultimately, they walked that back. That became a look at banning soda and candy, which ultimately wasn't included in the final bill. I kind of think because of the corn lobby and corn syrup, if I had to guess. But so aside from the nutrition restrictions, there were a lot of other pieces that were not as covered as heavily, but have been ones that we've been seeing pushed for going on 7 years. So things like stricter work requirements for SNAP, asset testing, this real-time eligibility verification system, identity authentication. So there were a lot of different pieces. We did see some of the more harmful pieces removed, but ultimately there was a bill that passed both the Senate and the House, Senate File 494, and that is awaiting signature from the governor. What it would do is establish an asset limit for SNAP of $15,000, and there's certain exemptions for vehicles, property, and retirement accounts. Now, we certainly heard from some folks who would be affected by this because they fall above the asset limit. Heard from a woman who's been saving for 10 years for a down payment on a house who would fall above that 15,000. Talked with another gentleman who owns a little bit of farmland and farm equipment, and that would put him over the limit. Well, our larger concern with this is that this is going to end up removing a lot of people from SNAP who fall well below that $15,000 limit, but struggle to prove that they fall below that limit. When Pennsylvania established an asset test for SNAP in 2012, they saw about 14% of everyone on the program removed, not because they fell above that asset limit, but because they couldn't provide the documentation in time. And that's our concern. It also creates an electronic identity authentication system. So instead of walking in and showing two forms of ID, you'll have to fill out a little computerized questionnaire with questions about credit history, things like that. And it would enlist the help of a third-party vendor to implement a real-time eligibility verification system. This just means we're going to do all these data cross-checks month or daily, weekly, biweekly, monthly, and we're going to run all these checks to make sure all this data is correct. And if someone gets flagged in the system, they've got 10 days to dispute that change. That third-party vendor actually has a financial incentive to remove people from the program. They get a contingency bonus based on the number of the total savings, i.e. number of people removed from the program. We think that's very problematic. But overall, we feel these just create additional barriers to access assistance. People during their redetermination period are going to struggle finding all those documents and are going to fall off and then need to reapply. And that's going to increase costs. People are going to be discouraged from applying in the first place. If you're trying to get a senior, signed up for SNAP and they're already hesitant, and then you're going to tell them, oh, by the way, the state's going to go through all your bank accounts, that might discourage them from applying for the program. So ultimately, we feel like this is just going to end up removing people who are eligible, who would be eligible, but can't meet these additional hurdles or just throw up their hands in frustration and say, it's not worth the time. I will just say, this is still awaiting the governor's signature. We've called on Governor Reynolds to veto the bill. If you want to do a little advocacy today, you could reach out to her office and ask for her to veto Senate File 494. So you've also might have been hearing about SNAP recently as it relates to the debt ceiling fight. So a little bit of background here. In March of this year, we saw a bill introduced called the America Works Act of 2023. This had a number of co-sponsors in the House, including Representative Randy Feenstra from Iowa's 4th Congressional District. This would expand that definition of ABOD to include people age 50 to 65 and parents above the age of 6. So again, currently, that time limit exists for people between 18 and 49, no dependents in the household. They have to be working at least 20 hours a week or can only get 3 months of benefits every 3 years. This would expand that population of people who have to meet that requirement to include people age 50 to 65, and parents of children above the age of 6 would need to meet that work requirement as well. We saw that getting kind of pushed by some of the elements on the right to be included in this debt limit bill. I think that the age and the parents were a little too expansive for some people, but we did see in McCarthy's debt limit bill that passed an expansion of ABOD to include people age 50 to 55. It would also prevent states from carrying over exemptions. Iowa doesn't really do that. What's next? We don't know. I will say Biden has hinted that he might be willing to look at this ABOD work requirement for SNAP. I know there's lots of Democrats in Congress who are pushing the administration not to consider these. There's also a separate work requirement for Medicaid that's being looked at. So we're just keeping an eye on this. What I can say is there's a lot of research on work requirements that show they don't actually lead people to employment. They only remove people from benefits who can't meet that work requirement. And for people to age 50 to 55, we know this is a population that struggles to find employment if they've lost it. And really, this is going to just remove those people from the program. It's not going to leave them in a better position to find employment. It's going to leave them worse off. All right. I'm watching my time. I'll try to cover the Farm Bill really quick. You might have been hearing things about the Farm Bill this year too. This is a big federal package that's passed every 5 years, and it's got to be passed by September 30, or they might do a 1 year continuing resolution if they don't have everything figured out, and kind of temporarily fund it and then kick the can to next year. There's 12 titles in the bill, including nutrition, which is Title 4. So it's called the Farm Bill, but Title 4 makes up nearly 85% of the budget of the Farm Bill. And the biggest portion of that, of Title 4, is SNAP. So SNAP is the biggest piece of the Farm Bill in terms of budget. So that's why the Farm Bill is so important for SNAP advocates, because it only gets brought up for debate every 5 years. So we've got, once every 5 years to really push for positive changes we want to see for SNAP in the Farm Bill, and also defend, from bad proposals. So this is a Farm Bill year, and Iowa has a really important role in these negotiations. Both of our senators, Senator Grassley and Senator Ernst, are on the Senate Agriculture Committee. And then 2 of our 4 congressional representatives, Representative Nunn of the 3rd District and Representative Feenstra of the 4th District, are on the House Ag Committee. So we really do have a really important role in these negotiations. We're also just known as an agricultural state. And I want to make sure that, yes, we're talking about ag issues in Iowa, but SNAP's also a really big deal in Iowa. It's sometimes framed as this, urban issue. Well, no, there's a lot of people in Iowa who rely on SNAP as well. So talking priorities for the Farm Bill, I won't go through DMARC's or IHC's priorities. Every group has their own. So I just threw out kind of a list of a few that you might check with. So obviously, Academy of Nutrition and Dietetics, Center for Science in the Public Interest, the National Sustainable Agricultural Coalition, Food Research and Action Center, National Farmers Union. You can look at DMARC's. A lot of different groups have their priorities. So I would just encourage you to find one that you're familiar with and check out what they are looking at this year. Okay, that was a lot packed in. So I'm going to kick it back to Kat real quick, and then I think we'll take some questions.
Thank you so much, Luke. That was a lot of really fantastic information. Before we jump into the questions, I just want to make sure I share some closing information, some housekeeping. So if you are an Iowa Academy member, please consider getting engaged with our policy team in any way that you're able to offer. We're seeking to fill 3 new positions on our policy team this upcoming year. However, if you don't have the time or ability to commit to a full position, we really will take as much or little time as you're able to give for smaller tasks. Everything really helps when it comes to advocacy. You're also welcome to join our monthly meetings, and you can reach out to us at policyeRightIowa@gmail.com. Luke, what is the best way for people to get involved with what the Iowa Hunger Coalition is doing?
I'd say the best way is to just visit our website, iowahungercoalition.org, and there will be a little pop-up to sign up for our email newsletter. Signing up for that email newsletter is by far the best way to stay updated and get the latest news from us and action alerts.
Perfect. And I saw that you put your email as well.
Put my email
that
in
I
the
share
chat
those
there
with
too.
the slides as well. I can add those to the slides as well for the posting, if that's okay with you, or would you prefer to just keep them in the chat?
No, that's fine.
Okay, great. Again, we're so thankful for your time today and everybody that's watching this recording later. This webinar will be recorded. If you want to reference this or the slides for future reference, you should receive a follow-up email within the next week or so with this information. And then we would really greatly appreciate your feedback by filling out the evaluation survey for today's webinar. Filling out the survey is also how CDR credentialed dietitians and dietetic technicians can receive 1 CEU credit for viewing this webinar either live or recorded. And then we'll also use this information to plan and improve future programming that we put on. So I think that's all. I'll also put those links and everything in the chat as well. And at this time, we'll just take some further questions. Luke, are you able to see the chat to answer questions yourself or?
Yes, yeah.
Okay, great.
I saw a question from Jen about, can you speak to if DHS still uses workers determined unfit for employment to get around work requirements? I used to be an income maintenance worker. I'm not sure. I wrote that down. I'm going to look at the policy manual, which is my usual go-to because I don't always get questions answered from HHS right away. So most of the time I just go look at the policy manual. I am not sure. Sorry, that's not a good answer. I think that was the only kind of question I saw in there, unless I missed any. But yeah, if anyone has any, feel free to put them in the chat. I mean, now at this point, if you just want to unmute and ask, I might stop sharing.
Luke, if the governor does sign the 494, how long? I mean, because would that take a while to get all that in place? I mean, like, when would that, you think, go into effect that they actually could start, right? I would think it would take a little bit for the systems to get set up.
Yes, yeah. If the governor, assuming the governor signs it, I think it has a starting implementation date of July 1st. But we know that all the different pieces of the bill are not going to be implemented all on July 1st. Looking at the fiscal note, going to be implemented over a series of 3 years. So we don't really know when different pieces are going to be implemented. That's why we're kind of forming a group to follow the implementation of this. So we know, when they're going to start this asset test or different pieces like that and can get the word out and let people know. I think my read on it is the asset test will be probably one of the first things that they will do. I think this real-time eligibility system will take a little bit of time. There's also this piece that I didn't mention related to Medicaid and child support recovery payments, which has a big it would add a lot of employees to the department. And I think that's probably one of the things they'll do last, just looking at the fiscal note. So we don't know exact dates for the implementation timeline right now. But looking at the fiscal note, we know it's going to be rolled out over 3 years. And we've got a group that's going to be trying to follow these changes when they're going to be going into effect. And we'll be trying to keep everyone informed about that. So great question.
Hi, Luke. This is Susie Wilson, and I really enjoyed all the information about SNAP. I do have a question about one of the initial slides you shared where it said like a general work requirement for adults is 30 hours a week. But how does that make sense, like in the context of the able-bodied adults have to work 20 hours? Or I just wasn't even sure about that general requirement for work.
Well, yeah, and what I said was the general requirements kind of loose. I don't even know really how that is enforced. I think it really exists to prevent people from willingly leaving employment and retaining their SNAP benefits. So that basically says if I'm getting SNAP benefits and I leave my job for no good reason, I can't keep getting SNAP benefits unless I'm registering for work and that sort of thing. I think it's also a way for folks who are not working to say like, well, you've at least got to register with, Iowa Works or something like that. That 30 hours a week, I don't think they actually track that. And like I said, the general work requirement is not as enforced as the ABOD rules.
Okay, thank you.
But yeah, great question.
Hi, Luke. I had a question. So I know when individuals first sign up for SNAP benefits, part of that process is a phone interview. And I'm just wondering, has there ever been any consideration for that phone interview to be moved to an in-person interview? I work with a lot of elderly patients, and sometimes that phone interview step is a potential barrier for them getting signed up because they might not have a phone, or sometimes they're not the best at answering their phone.
Not that I'm aware of. I mean, the funny thing there is that it used to be all in-person interviews, and then they moved to phone because they saw in-person interviews being a barrier. I think to me, it just kind of underscores that there's not really a one-size-fits-all approach. This is something we were bringing up with the identity authentication questionnaire piece in the bill, because like I could see that being, removing barriers for some people. If I lost my ID or I don't have access to it because I'm a victim of domestic violence, or for whatever reason, I don't have an ID, I can still prove my identity by answering these like questions, about my history or whatever. So I could see how that would, reduce a barrier. But it also creates an additional barrier for, let's say, a senior who shows up at an office with two forms of ID and they're like, I'm sorry, you still need to complete this computer quiz that might ask questions about places you lived 20 years ago. Like, that's creating an additional barrier for that other person. So I guess that I know I'm not answering your question at all. Like, I think it'd be good for them to have it as an option to either be a phone interview or in person, because for some people that phone interview is going to be way more convenient, but for other people an in-person interview is going to be a lot more helpful. So yeah, I guess I don't have an answer. I don't know if that's something that HHS has talked about or not. But I know, a few years back they had switched to phone interviews because, requiring an in-person interview was seen as a barrier. So.
Yeah, that's fine. I didn't know if you'd be able to answer the question or not, but I appreciate the thoughts and information. Thank you.
Yeah, no, thank you, Andrea.
Anyone else? Like, I wonder if you'd be able to share, maybe this is a big question, but just from your experience working in this space, like what are some strategies that you found to be, most effective, or like recommended ways to go about advocating for these issues? I know that's kind of a broad question, but.
Yeah. I mean, I feel like I've gone about it a number of different ways over the years. Like this past legislative session, we were just like trying anything and everything and seeing what stuck because, we were just not having luck with any approaches. I guess I will say maybe this would be helpful from your standpoint, just understanding your group as, nutritionists, dietitians. There's this group called Frameworks Institute that they study just like messaging and framing and what sort of messages are helpful with specific groups of people. And they have done some of that on SNAP and have found that when you're talking to Democrats, using arguments about, like this is just the right thing to do, we need to make sure our kids are fed, like those are some of the most effective arguments. When you're talking with conservatives and Republicans, some of the most effective arguments that you can make around SNAP and winning support for SNAP are talking about how SNAP is an investment and it's an investment in health. Talking about early childhood nutrition and how, if kids in those first 5 years don't meet all these nutritional kind of guidelines and requirements, that can have a lasting impact on them for the rest of their lives. Talking about that, but also talking about, children in school and being able to focus and learn. And then one of the most effective things is talking about how, you know, SNAP, if we can improve people's, diets, and that will lead to, improved health outcomes and actually less public spending on Medicaid and health. And so framing SNAP as an incentive to improve health outcomes and reduce healthcare spending is actually one of the best messaging, tested for talking with Republicans and conservatives. So I would just say, if you're thinking about farm bill advocacy or state level advocacy and thinking about your role as a dietitian, making that case that a strong SNAP program can help improve people's, access to healthy food, can improve their diets, can help save spending on healthcare in the long run. I guess that's what I would say there. I don't know if that's helpful or not.
That is helpful. Thank you. It looks like Allie had a question as well, if you can see that in the chat.
You have recommendations of interdisciplinary individuals, orgs of systemically oppressed identities that are active in nutrition policy, change nutrition security. And in Iowa specifically, I would say the Iowa Food Systems Coalition is just kind of getting started, but they've been very intentional about taking an intersectional approach. There's a lot of national groups out there. So I know National Young Farmers Alliance does some good intersectional work. The Center on Law and Social Policy, CLASP, is like a think tank that does a lot of work on public benefits areas. They do a very good intersectional approach. From the kind of food banking, food pantry world, there's this group called Closing the Hunger Gap that really focuses on root cause advocacy, and intersecting issues of poverty. That's a good question about Iowa, though. I don't have, I guess, a good suggestion off the top of my head other than the Food Systems Coalition. I mean, even at the Hunger Coalition, that's something we're working on. We have an entirely white board, and that's something we recognize and are trying to get better on. But I think there's probably some national groups out there doing a lot better job than we are locally in Iowa. Yes, those three organizations you just listed are all great examples. Thank you, Allie. So yes, there's definitely some groups in Iowa that are doing it, but maybe not as large of groups. So I didn't mean to diminish all the great work that is being done in the state.
And I don't know if the chat shows up on the recording later, but I guess just to voice some of those organizations out loud for people, Allie had recommended the Food Corps, LSI, Monsoon, and the Meskwaki Food Sovereignty Initiative.
Yes, all good groups. And I would just say the Iowa Food Systems Coalition, a lot of those groups have been involved with as well. So it's kind of like a coalition of coalitions. So.
All right. Well, I just want to thank you so much for your time today, Luke, and for everybody that attended and everybody's going to watch the recording later. This was very informative, and I know we're really appreciative. So if there's any final questions, feel free to send them in the chat or, email later. Otherwise, I hope everybody has a good rest of your day.
Yeah, thank you all. Happy Friday.